For the equine practitioner, I think it's very important to remember that the state of your protocols, the state of your standard of treatment, the AAEP, the AVMA, and the NASPHV, National Association of State Public Health Veterinarians, which is the preeminent compendium on rabies protocol. All three of those very clearly state that a horse should be vaccinated annually. The best rule of thumb in knowing whether you're going in the right direction, especially on rabies, is one, recognize that the courts are much more lenient if you err on being ultra conservative. Number two, be sure you are very specific in your documentation. And number three, be sure that you are maximizing all the protections that you can for yourself, for the owner of the animal, for your employees, and then the proper quarantine so that that condition does not spread to other animals or other people that come into contact with it. When a rabies case or exposure presents to a veterinarian, I think it's very important that the treating veterinarian understand that they've now moved from what I would call standard veterinarian industry of practice to the highest level of duty of care. And given the fact that the disease is 100% fatal, and given the fact that those symptoms might appear early or they might not appear until 6 months or a year later, the veterinarian really is required to err almost always on the side of an overabundance of caution. And the best way that I can explain that to practicing veterinarians is that when an animal presents with potential signs of rabies, stop right at that moment and think worst case scenario. If this animal in fact is confirmed to have rabies, have I done everything in my protocols to treat it appropriately? The veterinarians, interestingly enough, are held liable under a couple of different theories. The very first being that if they have entered into a vet-client-patient relationship with that animal, the first duty is to be able to advise the owner that that animal is potentially presenting with signs that could be rabies. The second duty is to properly quarantine that animal and determine whether or not it has been vaccinated or unvaccinated, because the treatment protocols are so completely different. The third is if the horse is not vaccinated, to have an in-depth informative discussion with the client about the options of either euthanasia or alternatively a 6-month in quarantine, with the client being responsible and or the caregiver being responsible for all of the protective cautions that they have to employ during that 6-month period while they're dealing with the horse. And then the fourth is a failure to adequately warn the client of the potential health impact that's attributable to any caregiver or anyone who comes into contact with a rabid animal. Not that the veterinarian is to cross over into the unauthorized practice of medicine, but they have to give the owner of the animal sufficient knowledge so that they're aware that they need to sooner than later meet with their health care provider to determine what that next step should be for them. So veterinarians need to remember the preeminent creation of their level of duty to the client, and that's the formation of the vet-client-patient relationship, or what we fondly call the VCPR. But once you've developed a relationship with the client that's patient-specific and or through course of custom, say a large stable that has multiple horses that come in and out, with the understanding that those horses all are part of the patients that you're seeing, that creates the VCPR, the vet-client-patient relationship. And at that point in time, every step that you take with that client, with the owner of the animals, with the trainer who is serving as the agent of the owner of the animals, has to be done in such a way that you're meeting the elements of informed consent, that you're advising them of what the condition is and what the appropriate recommended protocols are in the industry. And then you have to document it, and document it specifically. So if it is important enough for you to convey it, then it's important enough for you to take the time and get it into the records accurately. The number one area of case law that holds veterinarians liable, it is almost always poor record keeping and a failure to give written informed consent verified by the client in detail that sufficiently matches the facts that have been presented. Understand, when you're dealing with potential rabies, you are at the top echelon of liability exposure. Almost universally, if there is a bona fide reason for the veterinarian to have suspected that there was rabies involved, the court will support that decision.